It's really a privilege to be selected as one of the cover articles in JBJS. The study is a prospective study at multiple centers throughout the United States. We enrolled 280 patients for hip resurfacing and followed them over 10 years with physical examination, X-ray, metal ion tests, and patient-reported outcomes. The need for this research was to basically prospectively collect information about how these implants perform over time. When we first started doing it, it was a new procedure and we really didn't know how these would end up. When we put in implants into patients, we always want them to last as long as possible and have the lowest complication rate. So 96% at 10 years is a very high success rate, and that gives us confidence that many will continue to last longer for them. The ideal candidate is an active male patient under the age of 65.